Good evening, Gail. Group 7 will discuss Hildegard Peplau's story, interpersonal relationship.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Hildegard Peplau was born in Reading, Pennsylvania in the year 1909, and he got her diploma program in Pottstown in the year 1931. Let's talk about her major concepts on her theory. The theory explains the purpose of nursing is to help others identify their felt difficulties. Nurses should apply principles of human relations to the problems that arise at all levels of experience. Peplau's theory explains the phases of interpersonal process, roles in nursing situations, and methods for studying nursing as interpersonal process. The next major concept is that nursing is therapeutic in that it is a healing art, assisting an individual who is sick or in need of health care. The next one is that the nursing is an interpersonal process because it involves interaction between two or more individuals with a common goal. Her theory also focus on the goal that is to achieve through the use of series of steps following a series of patterns. And the last of her major concepts is that the nurse and the patient must work together so that both become mature and knowledgeable in the process. On this slide, we will discuss the role of nurses on Peplow's theory, which are stranger, teacher, resource person, counselors, surrogate, and the leader. First one is the stranger. Stranger receives the client in the same way one meets a stranger in other life situations, which provides an accepting climate that builds trust. Teacher role, who imparts knowledge in reference to a need or interest. Resource person is a person who provides a specific needed information that aids in the understanding of a problem or new situation. The fourth one is the counselor. Helps to understand and integrate the meaning of current life circumstances, provides guidance and encouragement to make changes. The surrogate role is to help to clarify domains of dependence, interdependence, and independence, and acts on clients' behalf as an advocate. Lastly, the leader role helps client assume maximum responsibility for meeting the treatment goals in a mutually satisfying way. On the following set of slides, we will present a case scenario incorporating Peplau's theory on interpersonal relationship. On September 16, 2018, at 9:30 a.m., I was expecting a client from the ICU. Pre-orientation phase focus on the data about the client that is to be gathered, and the nurse develops own thoughts about the client and or the disease. Using this chart, the nurse should know his or her own behavior in order to carry out the duty without judgment. Now, the case scenario. The handoff report from the ICU staff is a 60-year-old male client lives at home with his wife. There were no prior medical history. Transferred from the ICU after 3 days admission due to pneumonia. Episodes of forgetfulness noted during the stay. The X-ray results are pneumonia, bilateral lungs, and droplet percussion is noted as well. After having the handoff, I am preparing for the next phase. But before that, PPE should be used. Neurovital signs, range of motion, and respiratory assessment are the priority assessment. The client has forgetful episodes, so I should give extra time in talking with the client. The second phase of Peplau's theory is orientation. Orientation focus on laying out of expectations and limitations, discussing of length of encounter, and discussing the plans as well. Identify what is the client looking for by actively listening. This case scenario, the orientation phase is applied. I introduce myself to the patient. Hi, my name is Robin. I am your nurse for today until 7 p.m. May I know your name and the date of your birth? Initial assessment includes client is conscious, coherent, Glasgow Coma Scale scored 15, pupils are equal, round, reactive to light, and accommodates. He is oriented to time, place, and people. He expresses that he is feeling better than the past few days. He is still with cough, body weakness, and there are crackles on both lungs are noted. Client was able to tolerate bleeding. The client's expectations were clarified. He wanted to regain his strength back and be able to perform his daily activities. I took notes and told the client that we will be working with others from the healthcare team to achieve this. I also said that his participation is expected for this to be happen. We also discussed about the length of encounter. I also asked him how he can learn and work on achieving the goals. He said, I love reading and I prefer having a leaflet or booklet to read about what is happening. This information was shared with the healthcare team with his consent. The third phase is the working phase. Problems are outlined. The nurse advocates for the client. The client participates in the interventions. Be person centered in your teaching approach and ask the client how they learn at its best. The working phase is applied in this case scenario. With my assessment, I collaborated with the healthcare team. The client was counseled and assessed together by the speech language pathologist and the dietitian. The physical therapist started working with the client about mobility and gross muscle strength restoration, while the respiratory therapist ensures oxygenation. Pulmonologists follow up on the antibiotic regimen. Clients' questions were addressed during the interventions. Leaflet or booklet was provided during the team's visit. In preparation for the discharge, it was agreed upon by the client and the healthcare team that it would be after 4 days of intervention, thus taking into consideration the team's evaluation. The last framework, which is the resolution phase. The resolution phase focuses on the time to prepare for termination of the relationship. The patient has already independence and the goals were already met. Gilchrist using Peplau's theory on termination, the nurse should ensure that the client is able to manage the situation using his or her own skills. The resolution phase were incorporated in this case scenario. This shared teaching provided such as flu and pneumonia vaccination, having adequate rest, importance of complying with the regimen at home, hydration and sanitation of environment. Needed follow-up consult discuss. Danger signs at home discuss such as blue lips, chest pain, fever, and shortness of breath. To summarize all the information stated above, it is critical that nurses have the ability to skillfully interact with patients in any setting. This fosters trust, mutual goal setting, therapeutic interventions, and improved learning experiences for the patient and the nurse. More often than not, nurses use a combination of nursing theories and conceptual frameworks in daily nursing practice. Theories such as Peplau's continues to evolve to guide nursing practice in the future. The information acquired through the interpersonal relation helps us to know the importance of nurse-patient therapeutic communication. In addition, it is important for nurses to utilize Peplau's theory and conceptual models in the context of appropriate settings and populations. In evidence-based practice, Peplau's theory provides strong building blocks to know more about the condition, about the patient, and proper way of communicating with them, which is essential to increase health promotion and health prevention behaviors for patients. In addition, this theory helps to validate nursing activities that can be directly responsible for positive health outcomes.